Welcome and thanks for joining us. My guest today is Dr. Wissam Ali of Nova Dental Anesthesia in Burke, Virginia. Dr. Ali, great to have you. Thanks for joining us.
Thank you for having me.
Let's start with just having you explain what sedation dentistry is.
Simply put, it's basically a dental procedure where, with the use of medications, we're able to relax the patient, make them feel more comfortable during their dental procedure.
Okay. Talk to me a little bit about what kind of care you provide to your patients at Nova Dental.
We pretty much provide all dental procedures, starting with cleanings, deep cleanings, fillings, crowns, root canals, extractions, implants, all the way to full mouth rehabilitation. Why
is oral care such an important part of someone's overall health? I don't think a lot of people realize that it's really tied into your overall health and well-being.
That is very true. It is the gateway to the entire body. Usually we notice with good oral care, there's a correlation with good overall health. Mm-hmm. Poor oral hygiene causes many medical conditions such as heart disease, pregnancy abnormalities or complications, diabetes, to the psychological aspect where people don't feel very good about themselves because they can't show their teeth, they can't smile. That has a long-lasting effect on how we talk to people, how we perceive ourselves, how we carry ourselves out on a day-to-day basis.
Well, we know a lot of people are anxious about going to the dentist. No offense, we know you're a great guy.
Most of our patients are anxious.
So who is your patient population? Do you have to have acute dental anxiety in order to go to your office? Who are the people who show up there?
So the longer we do this, the longer the list becomes. Of course, people that are anxious or people with disabilities, this is the only way to get them through the procedure. But then it expands to people with medical conditions, people such as children that can't sit through a procedure that lasts more than 20 minutes. We also have patients that don't have any anxiety, but they need a full mouth rehab to where nobody, even if they don't have anxiety, nobody would like to sit there with their mouth open for 3 to 4 hours while you pretty much work on every single tooth in the mouth. Some patients are hard to get numb. Sedation is definitely a good option because it ensures that the patient is not feeling pain and they're comfortable. People are busy, they don't have time to see the dentist 20 times a year, so they decide to take a week off or 3-4 days and just get everything done in as little as one appointment. So the list is just constantly expanding.
Can you walk us through the process when somebody decides, okay, I would like to explore this as a possible option? How does it work? Do they come in? Do they have a consultation? Do they call you? A lot of these people, as you said, some have disabilities, some are anxious. What's the protocol?
So what we hear from patients is that it took a long time for them to realize this is the time to seek help and to pick up the phone and call. And then when we interview patients after their treatment has been completed, they usually state that once they called, then everything just started falling into place. We understand that once the patient calls us, they have taken the biggest leap they possibly could take. And once they talk to one of our staff members, then it's up to us to take over, make it simple for the patient, bring them in, welcome them, make sure that they understand that this step that they just took is a huge step to taking care of their health. So we try, once the patient calls us, then it's up to us to make it as pleasant of an experience as possible and kind of take over, inform the patient, give them options, help them with financing, All those factors come into place once the patient calls. So the biggest thing is to just pick up the phone and call, and then let us guide you through this journey.
So you mentioned treating people with special needs. Let's talk a little bit more in depth about that, and especially those who have problems fulfilling their dental care situations at home, who can't really, who aren't taking care of their teeth basically on their own. Are there different options for this population? And if so, what are some of those?
So there is. The different options as far as sedation or general anesthesia relies on what type of dental treatment is being rendered to the patient. It's basically tailored to the patient's needs. Once we find out what the patient will require, that's when we will use sedation or general anesthesia to get the patient through that procedure. So there are different modalities, anything from mild sedation, also known as twilight sleep, all the way to general anesthesia that most people have experienced in a hospital for medical surgery. For something that's more extensive, we rely on general anesthesia so we can get a lot done. If we see a patient for a lot of dental work, we're going to do general anesthesia, but then when they come back for their recare cleanings, we do mild IV sedation. It's basically what the procedure is, and we try to keep the patient as light as possible to get them through it. But if it is an extensive treatment, then we want the patient to be comfortable and to allow us ample time to get all that work done, which sometimes it's quite a bit.
And so you have maximum flexibility to figure out what each patient needs, how much sedation, what their plan is. I mean, I assume there might even be some situations where you have to switch gears in process when you're in the middle of treating a patient?
That's the beauty of what we do, and the fact that we don't have to call in an anesthesiologist to provide anesthesia for the patient. I'm an anesthesiologist and a dentist, so a lot of times, some patients are on the fence. Do we need sedation? Do we not need sedation? And, one thing I've noticed, it helps when you let the patient drive the car. So I'll tell the patient, this is what you might feel. Are you okay with feeling a little sensitivity? And then sometimes they're still not sure. So I tell them, okay, let's bring you in. Let's start it this way. As soon as we notice, or you notice that your anxiety is spiking, then we can right then and there change to IV sedation, and we'll get the patient through it. And sometimes just knowing that you have options, we can get the patient through it. So it's basically patient's comfort. If they're not relaxed or they're not comfortable, then we just pause, talk to the patient, and they've already been informed. If this doesn't work out, we can switch to sedation. And sometimes, we just need the patient sedated for a short period of time. Most offices don't have the privilege of doing that because they have to call in an anesthesiologist. Nobody will, provide anesthesia for 1 hour. So with us, it's very easy.
Dr. Ali, your practice offers a treatment that would help a patient to restore a full mouth rehab, even when it looks like perhaps that might not be possible. Can you talk a little bit about what that treatment is?
Sure. So it's called Teeth in a Day. It has many names that it's known by: Teeth in a Day, All on X. We're actually utilizing this treatment more and more from the aspect that we can restore every single tooth in somebody's mouth. But there are patients that are completely against root canals because they've had multiple root canals fail and they've had to go back. And they simply don't want to be sedated multiple times in order to restore the entire mouth. Because the way it works, first you have to stabilize the health of the gums and the teeth, and extracting non-restorable teeth, and then waiting for healing, and then restoring the teeth themselves. So sometimes, and I'm doing this more and more often now, I'm giving the patient both options up front, because I've had a couple patients that we did restore every single tooth, and then, let's say 2 years later, something happened, a crown came out, or they needed a root canal, and they thought they were done. So with patients knowing that there is this other service where it can be done in one day, patients are actually going for this treatment more and more as they're becoming more familiar with it. It allows us to extract the teeth, place the implants, placing a bridge right on the implants that same day. So they walk into our office with their teeth that are in poor health, and then waking up with those teeth being extracted, implants in place, and a bridge screwed to the implants that same day. So sometimes we're doing this treatment to reduce the number of sedation appointments, time, and to reduce the possibility of needing something in the future where, when somebody gets everything done, they don't want to have to do something else, a year, 2, 3 years later.
It's pretty revolutionary treatment. You're having success with it, obviously.
We are actually more so than other procedures.
Wow. Do you work on kids as well?
We do.
Yeah.
We do. Quite a bit.
So the age range is?
2 to we've done 88. So,
wow.
Yeah.
Okay. And you said there are different types of anesthesia.
There
so,
is.
What do people do who don't have sedation dentistry as an option? Where do they end up getting their dental care, or how do they get dental care, or do they just? What happens?
So with patients that are positive, they require sedation because of multiple attempts, failed attempts at getting dental work done, and it didn't go well. They're willing to drive 2, 3, 4 hours. We have patients that come to our office from as far as 6 hours away. Wow. So once they find you, they'll take the drive. We have patients that will actually stay at a hotel close by, have their dental work done, and then go home. So with sedation dentistry, we found patients that definitely know they need it will travel. We'll find a way. As far as those same patients, when we talk with them and say, what did you do? They didn't do anything. Mm.
So,
and the problem just
I was going to
worsens.
say, by the time they get to you, do you have cases that you're just like, where do we even begin with this person? Or
all the cases are like that.
Yeah, because these people probably have put off their dental care
exactly.
for many, many years.
Exactly. Yeah. We spend a lot of time before jumping into treatment. Mm-hmm. You have to know what the patient is willing to go through, mm-hmm. how much work, if they need to space it out, if they want it all done at once. And really just by talking to people, you find out what their needs are, and then we go back. We already know what the entire treatment is. Then we interview the patient, and based on that interview, we tailor the treatment to their needs.
Mm-hmm. And I think, as we said earlier, I wonder if a lot of people really know what the lack of good dental care, what the effect can be on their overall health. And perhaps you're doing something that can help turn somebody's overall health around.
So with the cases that we see, come into our office, that's the best part, is after the treatment is done, because the patient is relaxed. We really get to find out a lot of things that helps us treat the next patient. Mm-hmm. So usually we interview the patient a week after everything's been completed, mm-hmm. and we tell them, next time we're just going to talk to you for about half hour or so. So don't worry, don't let your anxiety build up.
No treatment, right?
And I'm learning a lot from what they're saying. So some are telling me, give less options, give more options, discuss this, discuss that. And really, it's changing every day based on what we hear from patients. Because what we think or perceive in our minds is not really what the patient goes through in the thinking process. So we're
You're
changing.
getting patient experience live and in person.
Absolutely.
What should someone take away? What would you like people to know in the end about the idea of sedation dentistry and its benefits?
So we've talked about what the patient states afterwards, but really that initial consultation that we have, it seems like most patients share the same thoughts. My mouth is a disaster. I don't even think it's, to the point that we can work with the teeth. I just want people to know if they have anxiety, just get past the anxiety part to make the phone call. Mm-hmm. Don't think of everything that will happen afterwards. Let us take care of that. Just make the phone call, and then wheels will just be in motion. And one thing will lead to another. With some patients, we space out the treatment over 2-3 years, and some in one appointment. So whatever type of person you are, we will find a way for you.
Wonderful. Thank you so much. I appreciate it.
Thank you for having me.
We've been speaking with Dr. Wissam Ali of Nova Dental Anesthesia in Burt, Virginia. I'm Deborah Feinstein, and for more information on this series, you can go to WTOP.com and search Get on Top of Your Health. Thanks a lot. Have a great day.